Health and Human Services Secretary, Dr. Tom Price. Dr. Price, thank you for being here.
Thanks, Jonathan. Good to be with you.
Our new ABC News Washington Post poll shows that by a 2-to-1 margin, voters now say they prefer Obamacare to the Republican plan to replace it. After 7 years of beating up on Obamacare, shouldn't Republicans be worried about voting for a plan that is actually less popular now than Obamacare has ever been?
Well, as you know, it depends how you ask the question. If you ask the question, do you want to be able to select your doctor? It's overwhelming. If you ask the question, do you want to be able to select your insurance coverage? It's overwhelming that individuals want to be able to do that. In fact, those were the two promises that were made by the previous administration. Fact of the matter is that the current system, the ACA, Obamacare, whatever you want to call it, is failing the individuals in the individual and small group market. We've got counties across this country that only have one choice. Almost 40% of the counties only have one choice of an insurer. Next year, where there will be dozens of counties that don't have any insurer. As Senator Collins mentioned, we've got premiums that are skyrocketing. We've got deductibles that are so high that individuals have coverage, but they don't have care. This is a system that is crying out for reform and revision. And that's what we're trying to do for people to be able to have the kind of doctor and the kind of coverage that they want.
There's no doubt there are significant problems with the current system. But if you look at the Republican plan to modify it and replace it, more than 10 medical groups are against it. 32 cancer organizations oppose it. And on Thursday, in a rare joint statement by the biggest insurance companies in the country, called the Cruz Amendment unworkable in any form and warned it would lead to, quote, widespread terminations of coverage. So, Dr. Price, why this wall of opposition?
It's really perplexing, especially from the insurance companies, because all they have to do is dust off how they did business before Obamacare. A single risk pool, which is what they're objecting to, is exactly the kind of process that has been utilized for decades
but
to
they're against
care
it.
for
the
individuals.
Doctors are against it.
The challenge that we have is that the bill itself isn't the entire plan. It is a significant and an important and integral part of the plan, but it's not the entire plan. What we're doing over at Health and Human Services right now is going through all of the rules and regulations that were promulgated pursuant to the Affordable Care Act. Those places where it said the Secretary shall or the Secretary may, 1,442 times. And we're looking at those and asking the question, does this help patients or does it harm patients? Does it increase costs or does it decrease costs? And where the answer is wrong, we're going to move it in a much better direction.
So you spent Friday talking to the nation's governors, trying to get some of those, particularly Republican governors, on board here. And I saw a picture of you talking to Governor Brian Sandoval, Republican of Nevada. If you look at the governors, I understand that you have the governor of Kentucky saying he supports the bill with reservations, but there is not a single governor in the country that is on the record saying that they unequivocally support this bill.
What they will tell you and what they've told me, the vast majority of them, almost to a person, not quite, but almost to a person, is that what they need is flexibility. They need to be able to design, in this instance, a Medicaid program that works for their population. Don't dictate to us from Washington, D.C. what you are telling us to do, because we know how to do it better than you. Nevada knows how to take care of Nevada citizens better than Washington, D.C. And it's true across the country. So what we've heard from the governors is virtually unanimity on that kind of flexibility that doesn't exist to the degree now that the bill would allow for, and that's what the governors are calling out for.
So I remember, and I covered quite intimately the debate over Obamacare in the House, and I think talked to you several times during that process. One of the things that you were very critical of were the special provisions that were put in the bill to win over key senators. The Cornhusker kickback, the Louisiana Purchase, as you called both of them. These were provisions to win senators that were on the fence, Democratic senators that were on the fence. Now we see special provisions that are in this bill for Alaska, for Florida, for Louisiana, again, seem to be directly aimed at winning over key Republican senators. Do you have a problem with this? Well, I know you're not in the Senate. It's not you're not putting this stuff in, but you must be a little uncomfortable.
Yeah, let me respectfully suggest that really isn't an appropriate characterization. What we're trying to do is throughout this
is different treatment. I mean, Alaska's going to get more money under a special provision that is clearly written to tailor to Alaska.
You talk about a state that's unique. It's Alaska. I've learned from Senator Murkowski and Senator Sullivan the incredible uniqueness of Alaska and how difficult it is to actually provide care for individuals where they have, I think it's like 650 municipalities or cities that you can't reach by car. That's a unique situation. So what we need to do is to make certain, and our goal is to make certain that nobody falls through the cracks, that we're able to provide coverage for every single American that for their physicians and their care, and that it's done in a way that makes it possible.
So the bottom line, with this vote's been delayed, it was going to be possibly on Tuesday of this week. Did McConnell have the votes to get it passed?
I don't know, but let me take this opportunity to convey our best wishes to Senator McCain in this tough time for him. He's a fighter, and I know he'll be back. As Senator Collins said, I never underestimate Senator McConnell's expertise in getting the votes.
All right, Dr. Tom Price, Health and Human Services Secretary, thank you for joining us.
Thanks, Jonathan.